Yes, thank you. Thank you. Dr. Njoo, there have been several major cities, including Ottawa, have recorded a spike in cases in the last few days. Is this something of concern to you? Does this fall into the parameters that you were expecting would happen as the economy began to reopen?
Thank you very much for the question. Yes, it's something that we've noted at the national level, but also obviously in the individual provinces and territory, this uptick or this sort of increase in cases. As I mentioned, I think earlier, we were averaging about 300 cases a day. With a 7-day rolling average, and then more recently that's increased to 350, and now we're in a neighborhood of about 460 cases per day for the last 4 days or so. So that is of concern. We've done some analysis. I think the provinces and territories have obviously done their own analysis, and what we're noticing, and it's something that I do want to highlight, is that it seems that the vast majority or the increase in proportion of cases is among what we call young adults. Whereas, for example, back in May, it was a smaller percentage, maybe a third of cases across the board in Canada. More recently, it's been about 55%, and that is concerning. And so there are a number of reasons to explain this. Certainly, I think the reopening of businesses is one factor, but I think I'll take a step back. I think if I can call it sort of the three factors, the first one being fatigue. I think that, young adults as part of the general population, I think everyone's been tired, after spending the winter, cooped up, and now with the nicer weather and the summer, I think people just want to get out. So I think there is a fatigue factor in terms of trying to maintain all of those good public health measures, the ones I just mentioned, the physical distancing, washing your hands frequently, staying home when you're sick, wearing a non-medical mask or face covering if you aren't able to maintain the 2-meter distance and so on. So that's number one. Number two, I think among the young folks, I would call it the invincibility factor. I think young folks, I was young once, I think at a certain age, you think that you can get away with anything, that, you're basically able to, deal with anything that comes and there won't really be any major consequences. And that, I think, is a tough one because we have noted, and I think the young people have also noticed, that by and large, even though their risk of actually being exposed to COVID-19 is the same as anyone else, the fact is that certainly they appear to have less of a probability of having serious health consequences compared to, let's say, older age groups and also those with other underlying medical conditions. And so that's one thing that is, I think, playing on their minds maybe. The other part also is that many of the young folks, I think, are also having a very few or mild symptoms, and some are even asymptomatic. But that's where I think the challenge is, because even if they have mild symptoms or are asymptomatic, the fact of the matter is that they're part of our society. And so, they go to work. They obviously have older parents and grandparents, and certainly there's a risk of transmitting the virus to those who actually would be at higher risk of severe consequences. So that, I think, is another factor. And then I think thirdly, there's the issue of what I call, as you pointed out, the reopening, sort of getting to the new normal factor. Provinces and territories, everyone's trying to reopen at a very, I think, a prudent pace, slowly opening up bars and restaurants. But everyone recognizes that we would expect to get, clusters of cases, and it's really for the authorities at a provincial and local level to be able to monitor the situation, see what happens if there is a cluster, to be able to get on top of it very quickly with a good capacity in terms of early testing of potential cases, then making sure they're isolated and managed appropriately, doing the contact tracing and so on. And so what's happening then is that certainly some of the cases with the young folks, but also people in other age groups, are associated with the opening of bars and restaurants. But I've also noticed, and I think it's also been noted by authorities in the provinces and territories, that many of the clusters of cases among the young adults are also associated with indoor parties. And I'm thinking there, and I don't know, I don't have any actual proof, but the thinking might be that as bars and restaurants and society opens, that is maybe in some ways a signal for people to think, oh, okay, I can let go, things are returning to normal, and therefore they are getting together, indoor parties, probably with lack of social distancing and so on. So there are lots of factors in play, and we're certainly keeping an eye on it, and I think across the country, we need to redouble our efforts in terms of reaching all Canadians, including young folks. I think Canadians have made tremendous sacrifices, and we've succeeded overall in flattening the curve, but that success is fragile, and it only takes a few sparks and so on to backslide and create, obviously, the situation we don't want. Thank you.
And secondly,